Good afternoon. It's my pleasure and honor to introduce a distinguished speaker, Dr. Laith Mullah Hussein. He did radiation oncology specialization and training and education in Jordan, Germany, and Canada. Currently, he's an Estro Fellow and a consultant physician at Sultan Qaboos Comprehensive Cancer Care and Research Center in Muscat, in Oman. Dr. Laith was the founding director of the first Radiation Oncology Board program in Iraq. He acted as an expert within Impact IAEA from 2013 to 2021 and was an ASCO International Affairs Steering Committee member from 2016 to 2019. Welcome, Dr. Laith, and it's a pleasure to have you today to talk to us about a specialty portfolio in radiation oncology.
Thank you, Professor Zainab. Thank you for the colleagues at Ancient University for this kind invitation. It's a pleasure to be with my colleagues in Egypt to present a talk about specialty portfolio in radiation oncology, a global certification roadmap, which is a book that we published early this year. I don't have any personal conflict to disclose. Radiation oncology, as you all know, it's a discipline of clinical medicine that uses ionizing radiation for the treatment of patients with many malignant and some non-malignant diseases. It includes the responsibility for the diagnosis, treatment, and follow-up, beside the supportive care of the patient. Despite that radiotherapy is an essential component in the management of cancer patients, there is a global gap in its practitioners in many countries, especially in low, middle, and low-income countries. The lack of trained radiation oncology professionals is not only due to the lack of access to documents, rather it is the lack of the how-to instructions to establish and manage competency-based training. This is true in regions where no such programs exist, therefore the lack of a local model to follow. Better training for radiation oncologists can positively impact the management of cancer patients and help reduce the disparity in cancer care between developed and developing nations. The IAEA advises each country to have a national authority, which should be the ultimate responsible body for the organization and monitoring of the training program in the country, including the implementation of an audit system for the periodical evaluation of recognized training institutions and programs. This authority should also be responsible for the eligibility of the trainees and their certification. Each certification authority should create a suitable mechanism for continuous recertification to keep them updated with recent developments in radiation oncology by a system of lifelong learning to maintain competence within this evolving practice environment. Our aim is to transfer existing recommendations for establishing training programs into an easy to implement competency-based roadmap. It's a 150-page document concentrating on three main axes. First, didactic lectures and training. The roadmap document included which topics to study in which years of training with the credit hours and the clinical components. The clinical components were further divided into subcategories such as new consult clinic, simulations, treatment planning, and evaluation, besides on-treatment and post-treatment clinics. The second axis is the managing workflow. As we noted the lack of peer-reviewed meetings and consults, we have introduced site-specific clinics and guidelines with rotations. The document also includes division of trainees by groups and recommends a daily work schedule. Assessment and evaluation. Extensive forms for assessment and grading were provided. The grading system was explained such that each grade refers to a certain competence level. In anything, there is kind of ABC. So we have to define the mission of any program. So I think that the mission of the radiation oncology program in any country is to serve the patients, the public, and the medical profession by certifying that the diplomates have acquired, demonstrated, and maintained a requisite standard of knowledge, skill, understanding, and performance essential to the safe and competent practice of radiation oncology. The vision of the program is to have an advanced safety and quality in healthcare by setting the definitive professional standards for radiation oncology. And then the certificates is to have kind of board certification of radiation oncology or fellow of the national board or the national council or the national or the Royal College in radiation oncology. And this to be like at the national level. IAEA divides the level of trainings into 3 levels, the basic level and the advanced, and in between is the standard. So I will describe the standard level, and then the basic is the lowest level and the advanced is the best level. So the standard level is an intermediate level of planning using a simulator with patient contouring or a CT simulator, anatomical reconstruction, using diagnostic CT information acquired in treatment position, identifying target volumes and critical structures. Based on this information, an individual treatment 2-dimensional or 3-dimensional plan is created using the treatment planning system. Treatment is given using a linear accelerator. Patient position is checked during treatment and corrected if necessary. Mold room and immobilization devices are used. Brachytherapy using intrapavitary, interstitial, and intraluminal afterloading techniques is practiced with individual dose planning. So this is the standard level, is to have at least like kind of a 3D planning external beam besides the brachytherapy services. Now the advanced level is to have advances like the MRI, the PET CT, the 4D, and so on and so forth. So if the country is not able to have the standard, at least they can have the basic level and they can do the job. Like for example, by having cobalt and 2-dimensional and so on. Now then we'll come to the milestones of the training. So in the level 1, the trainee demonstrates milestones expected of an incomer, like first year training. And then level 2, the trainee is advancing and demonstrate additional milestones. Level 3, the trainee continues to advance and demonstrates additional milestones, consistently including the majority of the milestones targeted for residency. And then the level 4 is the graduation target, while the level 5 is the aspirational goals and a well outstanding resident. We have kind of entrustable professional activities, and based on these entrustable professional activities, we can categorize the level of training for each resident. So level 1 is to ask the resident just to observe us, for example. And then level 2 is to direct proactive supervision. The level 3, indirect reactive supervision. Level 4, without immediate supervision, but with post hoc report or remote supervision. And level 5, the trainee supervises more junior trainees. So in each site, in each technique, we are like going through all these levels. till the level 5, where the resident is kind of mastering the technique, mastering the field, so then he can move to another technique and another site. The 7 CAN-MEDS criteria from the Canadian Medical Education Directives for specialists. We have 7 rules. Each specialist is not only a medical expert, but beside the medical expertise, he needs to be a good communicator, a good collaborator, a good leader, a good advocate, and a good scholar, and beside that, a good professional person. And we here, like, combining the entrustable professional activities with the 7 CAN-MEDS rules in radiation oncology, and I can keep the slides for you later on for review. So the roadmap is a book that was created to provide a how-to recipe for the various complex training components of a residency program. And we are highlighting 2 things here, the clinical training and the academic credits. So the clinical training is meant to implement tables governing daily work for the residents and the clinical workflow. For example, we are classifying the residents into teams. So at least if we have, for example, 4 residents, we are classifying each resident into a team. And this team can contain a group of cancer sites, and to rotate on annual basis in these cancer sites. For example, every 11 weeks, he has to rotate from one team to another team. And the classification of this grouping is just kind of for simplicity. So it doesn't necessarily to be GI and GYN together. It could be GI with lung or GI with the breast and so on and so forth. It's just kind of grouping the cancer sites and dividing them on an annual period. And then 5 days a week or 6 days a week, depending on the training and the work, we are classifying the work. And this just to avoid the kind of hazards and randomization of the residents. So we need to make the resident focusing on certain team with a good routine so he can learn in a systematic fashion. For example, the blue team, which is the lymphoma, leukemia, thoracic, and musculoskeletal. On Monday, they have new patient clinic. On Tuesday, they have simulation. On Wednesday, they have contouring. And on Thursday, they have on treatment review clinic and post-treatment clinic for follow-up. While, for example, on a Friday, to be an academic day. In other nations, could be from Sunday to Thursday or from Saturday to Thursday and so on. So this achieves 2 purposes: provide a recipe that is easy to follow for implementing the training, and organize the workflow of the entire clinic. Creating site-specific learns for training will result in creating site-specific departmental clinics. This produces specialized teams to improve patient management. So the resident can read about each site, and then the trainer can assess him on that site. It's better than the resident just join X or Y of the trainers, and then whatever the cancer patients they are seeing, he is like following. This will give him the space to read about the site in general. So we mentioned that major rotations every 11 weeks, total of 44 weeks per year out of the 52 weeks. So the remaining weeks, 8 weeks, we are suggesting a minor rotations. So in the first year, to have 4 weeks rotation on onco-imaging and the nuclear oncology, and 4 weeks on oncopathology and laboratory. In the second year, 4 weeks in medical oncology, including adult and pediatric, solid and hematology, and another 4 weeks in palliative oncology and emergency oncology. In the third year, 8 weeks in surgical oncology. So it's not just surgical oncology, but pediatric surgical oncology, orthopedic surgical oncology, thoracic surgical oncology, gynecology surgical oncology, and head and neck surgical oncology, neurosurgical oncology, and so on and so forth. So it's all detailed in the document, in the book. At the fourth year, the trainee can either continue at the same center or rotate at another recognized radiotherapy training program, whether inside or outside the country. It's good to have another flavor from another place of training. So this is about the clinical duties. For the academic credits, a detailed tables of academic credits include what topics to study and in which year, with suggested hours for didactic and practical training. So the 100 credits with 83 of the credits concentrating on the clinical module and 17 on the non-clinical. So for the basic, the medical physics, oncoradiobiology, critical appraisal, medical statistics, and epidemiology, oncopharmacology, oncopathology and laboratory, and oncoimaging and anatomy. And for the clinical modules, radiation oncology, nuclear, medical, palliative, and emergency and surgical. So the bulk of the credits is for the radiation oncology, 71, and the 29 credits in other disciplines, medical, basic science, and the non-radiation clinical fields. And here the didactic hours, the practical hours, and this is the total credits. We have to assess the trainees in different sites. And this is just an example at the end of the, every year, the distribution of the marks. Of course, the distribution of the marks can be different from community to community based on the priorities of the cancers in that community. And this is besides the other disciplines that the residents need to understand and make sure that he has or she has a good knowledge in these. So these are the clinical sites, and beside we have population health, epidemiology, methodology, physics, and technology, clinical oncology, and other milestones. And this is kind of a form of evaluation, and using the CANMED's 7 criteria beside the 14 EPA, and with the grading system. This is just one annex out of over 10 annexes in the book. So in conclusion, this roadmap was applied successfully at the Gianoma Cancer Center in Iraq in 2013, and the first residents completed the program in 2017. The program is still ongoing there with the 10 graduates so far. The successful implementation of the roadmap approach revealed that it was indeed the how-to details that we are missing in creating training programs. The roadmap approach was reviewed, endorsed, and finally published as a book in February 2021. To date, the PDF version of the book was downloaded over 4,000 times. The high number of downloads may reflect the interest to improve the radiation oncology resident training globally. Future work remains to investigate the success of this approach in other developing centers and to translate this document to other languages. My take-home message here that this roadmap is a book that gives a guidance with information on radiation oncology certification from a global perspective. The idea is to help establish competency-based certification programs in radiation oncology worldwide. The portfolio provides a training roadmap that can be applied in many communities, particularly those with limited resources to produce qualified, competent, and safe radiation oncology practitioners. It is extracted from different well-established resources in this field and can be used as a general guide in tailoring and refining the programs at every accredited authority, or as a representative model and content, or through its sample tools to facilitate documentation. So it's a handbook and logbook. So every authority can take it as a model and edit it according to the circumstances in that nation. It refers to many resources that can be useful to trainers and trainees to achieve the required milestones radiation oncology certification, which will further advance the level of education and the practice of radiation oncology globally. We would like to thank Qatar University Press for providing comprehensive peer review process and granting open access publication. Also to thank the Arab Medical Association Against Cancer, AMAC, for their endorsement. To thank Professor Erickson, the ISTRO School Director, and Professor Al-Ghazi, he's from University of California, Irvine Medical Physics Director, for their reviews and forward letters in the book. The book is available online as a PDF open access from this link, and also those who would like to use it, use the Kindle version, it's also available in Amazon. Thank you for your attention. I will be happy to have your feedback, questions, comments.
Thank you so much, Laith, for this excellent and to the point presentation of the roadmap for training of our residents. First, we are going to take comments or questions from the audience. If you have anything to ask Dr. Laith to clarify or to comment.
Thank you, Dr. Laith, for your presentation. I would like to ask about, is there any direction that this program can be made, that it can be internationally acknowledged, that the graduates of this program can be internationally acknowledged somehow?
So we don't have such authority to make it an international acknowledgement. We have kind of endorsement. We hope that at some point when some countries apply it, then we may have kind of affiliation. I am aware that the medical physics now, there is international board in medical physics, and they are certifying many of the colleagues in medical physics by a diploma-like degree, which is well recognized in many of the nations. So here we need to have the recognition that give us the license beside the certification. So if, for example, suppose that there will be a certification program, and then the person is certified by this authority, whether he will be licensed to practice using this certification. So this is the issue. So we need to have the licensing body that acknowledge the certification authority. So for example, in Iraq, we have the national board, we call it Iraqi Board for Medical Specialization, and they are certifying the diplomates. And then the association, which is the responsible body for the licensing, they recognize this authority for certification. But suppose that somebody will come from another nation, but that nation, the certification authority is not recognized in this country. So we need to have kind of equivalence to make it acceptable. So we are not yet at this level. There are some, I mentioned the medical physics, but not in the radiation oncology so far to my knowledge.
Okay, thank you. I have to say it's a great effort. Thank you.
Thank you.
Any other questions or comments? Actually, Lais, I have like a question. It's not a question. It's the challenges that you have faced and how did you overcome them? And if you have some practical tips, because this roadmap, it seems perfect. And on paper, for us, it may be very appealing, but on reality, it may be challenging. So what were your challenges?
Thank you, Professor Zainab. Actually, we published the challenges that we faced in establishing this program at the ISTRO journal in 2019. I remember among the challenges was where the manpower, where the financial issues, where how to bring the experts to Iraq to like help in the educational process, how to bring the examiners, how to convince the authority to establish the radiation oncology as an entity, like in separation from the old school of clinical oncology, how to replace the old certification approach, which is the DMRT diploma, which is 2 years established based on the British style in the 1960s. And that diploma program established in Iraq in 1980s and was running till now. So how to stop, how to replace this old standing program of 2 years and certifying the diplomates to be qualified in medical and radiation oncology by another program, which is 4 years in radiation oncology only. So, and both of them, they are recognized by the Ministry of Health as a specialist. So we faced a lot of challenges. We explored all these with the solutions that we took in that paper, and I'm happy to share it with you guys.
Thank you so much, and thank you for the clarifications. We appreciate your time and effort, and I know that you are quite busy during this time. So thank you so much, and we hope to see you next time in Cairo. With this, I'd like to close this session and to thank the audience for their presence and attention. Thank you so much.
Thank you very much for inviting me. Have a good night.
And you too.